Last time I talked about unsteady walking, I heard from you, a lot of you, hundreds of comments, all saying the same thing. Show us the exercises. Don't just explain them, demonstrate them. You were right to ask. Today, I'm correcting that. Every single exercise in this video, I will show you live, right here, so there is zero confusion about what to do and how to do it. Now, let's get something straight before we go anywhere else. Think about 3 people who can't walk in a straight line. A stroke survivor, a man who's had too much to drink at a party, and a 10-month-old baby just pulling herself up to stand for the first time. All 3 wobble. All 3 can't hold a steady path. And every single person watching this would look at them and draw 3 completely different conclusions. Because the causes are completely different. That's the point. Here's the mistake I watch people make constantly in my practice. They start stumbling when they walk, and their first instinct is to do leg strengthening. Maybe squat more, buy calcium supplements, look up balance exercises on the internet. They do all of this, and nothing changes. Nothing. Because they're treating the legs, and the legs are not the problem. If you wobble when you walk, if you drift sideways crossing a flat parking lot, if you lose your footing on perfectly level ground, that is not a leg problem. That is a brain problem. Specifically, a blood supply problem in a part of the brain called the cerebellum. Today, I'm going to tell you exactly why that is, exactly what's happening inside your body, and show you, on camera, what to do about it starting today. We're 20,000 subscribers away from 200,000 on this channel. If you've ever watched a video of mine and thought, this actually helped me, subscribe right now and hit like. I'll be honest with you, the medical industry doesn't profit from you getting better. It profits from you coming back. This channel exists to change that math. Let's start from the foundation. Why is stumbling not a leg problem? Here's a thought experiment I walk patients through. Take a perfectly healthy person and ask them to stand on one leg. They stand there, one foot on the floor, the other in the air, and they are completely stable. Minimal support, perfect balance. Now take someone with a coordination problem. They walk down a wide, clear hallway. Both legs working, muscles fine, joints fine, and they veer off to the side. What's the difference? The legs in both cases are fine. The difference is who's running the show. Your muscles and bones are mechanical hardware. Incredible hardware, honestly. Millions of years of evolutionary engineering. But hardware doesn't know what to do by itself. It needs a command center. That command center is the brain, and specifically a structure called the cerebellum. The cerebellum is your balance computer. Every fraction of a second, it's pulling in data from your muscles, your joints, your inner ear, your eyes, and it's issuing micro corrections that keep you upright and moving in a straight line. When the cerebellum runs perfectly, you walk without thinking. When it starts running on reduced power, you stumble. That's the whole mechanism. Here's something about walking that most people have never consciously thought about. Walking is controlled falling. That is not a figure of speech. It is a literal biomechanical description of what happens. Every time you take a step, you lean forward, your center of mass moves beyond your base of support, meaning for a split second, you are falling. And at that exact moment, your leg automatically swings forward to catch you. Every step. Controlled falling, caught by a leg. And the cerebellum is the one running that timing. Get the timing wrong by a fraction, and you stumble. This is why a toddler falls so much when she's learning to walk. It's not weak legs, it's an untrained cerebellum. Over months, the cerebellum builds the program. The patterns become automatic, and she walks without falling. But here's what happens decades later. When we get older, coordination problems can return. And this time, it's not about learning, it's about blood supply. The regions of the brain that control movement, including the cerebellum, start getting less oxygen. And a brain region running on reduced oxygen simply performs worse. The brain is an organ. Same as your heart, your liver, your kidneys. It needs good blood flow to work. Here's a number that always gets patients' attention. The brain accounts for about 2% of your body weight, but it uses roughly 20% of all the oxygen you breathe. 20%. It is extraordinarily sensitive to any reduction in blood flow. Cut it even slightly, chronically, over years, and you feel it. And here's what I've noticed in clinical practice. Patients who come in with unsteady walking almost always have other symptoms too. Symptoms they've never connected to each other. The first is short-term memory problems. You walk into a room and within seconds, you genuinely cannot remember why you went in there. You start a sentence and lose the thought halfway through. But 30 years ago, crystal clear. This is a pattern. Short-term memory requires active energy delivery right now. It's the first thing to degrade when blood flow dips. The second is mental fatigue. Work that used to feel manageable now feels like lifting something twice as heavy. By mid-afternoon, your brain feels like a phone battery in the cold. It's there, but it's running down. The third is brain fog. My patients describe it as thinking through wet cotton. Everything is just slightly slower, slightly harder to grab onto. If you recognized yourself in any of those, stop and take that seriously. Not as a reason to panic, as a reason to act. This is not inevitable. It is fixable. Now let me tell you about the cerebellum specifically, because most people have no idea what it actually is. It sits at the back of your skull at the base. In terms of volume, it's about 10% of your total brain. But in terms of neurons, nerve cells, it contains more than half of all the neurons in your entire central nervous system. More than 50% of your brain's processing units in 10% of the volume. The cerebellum is extraordinarily dense computing power. And when its blood supply is compromised, you feel it immediately. I had a patient a few years back, a woman named Carol, mid-40s, came in for what she described as just clumsiness. She'd been bumping into door frames, dropping things, drifting slightly when she walked. Her GP had told her she was probably just tired and to exercise more. She did. Nothing changed. When I took a full history, she also mentioned she'd been forgetting words mid-sentence for about a year, and that she was exhausted by 2 in the afternoon despite sleeping 8 hours. She'd connected none of these. I connected all of them. The pathway from the neck to the cerebellum was being compressed, and her cerebellum was working at maybe 60%. We addressed the mechanical restriction in her neck over several weeks, added the coordination exercises I'm about to show you, and within a month, her family was commenting on the change. She was walking straight. The word finding improved. The afternoon crash faded. That is what restoring blood flow to the cerebellum looks like in a real person. So why the neck? Why is the neck the key here? The answer is pure anatomy. 2 arteries supply blood to the back of your brain. They're called the vertebral arteries. And here is what makes them unique. They don't run alongside the cervical spine, meaning the neck vertebrae, they run through it. There are small holes in the lateral processes, the side projections, of each cervical vertebra, and the vertebral arteries travel right through those holes, bone by bone, all the way up the neck. Then they loop around the atlas. That's the very first cervical vertebra, the one your skull sits on, and enter the skull. Once inside, the 2 vertebral arteries merge into a single vessel called the basilar artery. And the basilar artery is what feeds the cerebellum, the brainstem, and the back portions of the brain. This entire system is called the vertebro-basilar circulation. Do you understand what that means structurally? The artery feeding your cerebellum is threaded through your bones. It passes through vertebrae. If there is tension in those vertebrae, stiffness in the joints, chronic muscle spasm, restricted mobility, that affects blood flow. The vertebra shifts slightly. A muscle stays chronically contracted. The artery gets an additional kink in it. The lumen, the inside diameter of the vessel, narrows. Not dramatically, not stroke level, but chronically, persistently, over months and years. And that slow, chronic reduction is exactly what produces the symptoms I just described. Our goal is mechanical. Remove the restriction in the neck, restore the natural alignment, and the blood flow improves. The cerebellum gets better supply. Coordination improves. It really is that direct. Before we get to the exercises, I want to stop on something, because this is where I see people go wrong even when they're trying to do the right thing. When someone feels tension in their neck and decides to stretch it, they typically tilt the head forward, pull the ear toward the shoulder, maybe roll the neck around. All of that movement happens at the mid-cervical spine, the 5th and 6th cervical vertebrae. That segment is already the most mobile part of the neck. It's already under the most daily load. Adding more movement there does nothing helpful, and done aggressively, it can actually cause problems. Where the restriction actually lives is somewhere else entirely. The first problem zone is the cervicothoracic junction. the 6th and 7th cervical vertebrae, and the 1st and 2nd thoracic vertebrae at the base of the neck. This is where chronic restrictions actually build. This is where that bump at the base of the neck comes from, the one people often call a dowager's hump. That is not fat. That is a chronic mechanical block in the muscles, ligaments, and joint capsules of that transition zone, and it directly affects vertebral artery flow. The second problem zone is the upper cervical spine, the 1st and 2nd cervical vertebrae right at the top. This is where the vertebral arteries make their final bend before entering the skull. Restriction here affects flow at the last possible point before the blood reaches the cerebellum. 2 exercise blocks today. Block 1, release the neck, specifically those blocked zones. Block 2, train the cerebellum directly. Exercise 1, mobilization of the cervicothoracic junction. First, find the 7th cervical vertebra. This is easy. Drop your chin slightly toward your chest and run a finger down the back of your neck to the base. You'll feel one spinous process. That's the bony knob on the back of each vertebra that sticks out noticeably more than the others. That's C7. In anatomy, it's literally called vertebra prominens, the prominent vertebra. I'm going to show you exactly where that is. Here's the principle of this exercise. When you turn your head to one side, the cervical vertebrae rotate with it, but the lower ones, C6, C7, T1, participate in that rotation far less than the ones above. Their ligaments are tighter, they lag behind. Our job is to assist them, specifically to place a fingertip on the spinous process and help it rotate in the same direction the head is already going. Not force it, assist it. Place the pad of your finger on the side of the spinous process of C7. Begin turning your head, let's say, to the right. As you turn, apply gentle pressure with your finger to the right, nudging the spinous process in the same direction. Soft pressure. These ligaments between vertebrae are elastic structures. They have give like a firm rubber band. You are looking to feel a slight elastic resistance under your finger. That's the end point. Don't push through it. That light tension is exactly what you want. When you return your head to center, do not release the finger pressure immediately. Keep the vertebra held for a moment as the head comes back. This creates an additional stretch on the joint capsule and the ligaments between the processes. That stretch is where the therapeutic effect lives. One more important detail. If you feel that the spinous process is already deviated to one side, sitting off center, use your movements to gently guide it back toward the midline. Do not push it further in the direction it's already drifted. Every movement should be working toward neutral alignment. After C7, move to T1, just below. Same technique. Then T2. It participates even less in rotation, so work even more gently. I'm going to walk through the entire sequence right now so you can see exactly what this looks like. This junction accounts for only about 5 to 10% of the total range of motion in the neck. A small percentage, but disproportionate importance. When this zone moves freely, everything above it feels better. And this junction connects directly to the shoulder girdle. So as a bonus, freeing this area also improves shoulder mobility. Exercise 2, cervical muscle stretch. A chronically contracted neck muscle presses on surrounding structures, including the vertebral arteries. Gentle, correct stretching of these muscles is direct therapy, not a comfort measure. Place one hand flat on your collarbone, the clavicle, on one side and press it down. Now, slowly and without any jerking motion, tilt your head to the opposite side and lift your chin slightly upward. You will feel a stretch along the front and side of your neck. That's the sternocleidomastoid, a long name for a very significant muscle that runs from just behind the ear all the way down to the collarbone and the breastbone. When it stays chronically tight, it pulls the head forward and compresses the structures of the neck. Hold this stretch at the level of comfortable tension, not pain, not sharp sensation, just a clean pull. Breathe normally, then slowly return. Change your angle slightly, more to the rear this time, to reach the posterior lateral portion of the neck. Then switch sides. No ear to shoulder drops. That loads the already overloaded mid-cervical segments. I'm going to demonstrate the full sequence. Finish with self-massage. Reach both hands around the back of your neck, place your fingertips on either side of the vertebral column, and work the muscle bands on both sides with firm but gentle kneading pressure. Safe, effective, and it completes the release. When you work on your neck, keep one thing in your mind. This is not just a mechanical joint. The neck is the corridor through which all communication travels between your brain and your body. Every blood vessel, every nerve pathway passes through here. Freeing the neck improves cerebral blood flow, which means sharper memory, clearer thinking, better mood. Improve circulation to the scalp and the hair follicles. Better skin perfusion in the face. One structure, cascading benefits. Now, block 2. We've improved the blood supply to the cerebellum. Now we need to actually train it. The cerebellum responds to training exactly the way a muscle responds to training. Given a task that challenges it, and it adapts. It increases its own metabolic activity, strengthens existing neural connections, and builds new ones. This process is called neuroplasticity, the brain's ability to reorganize itself in response to demand. The cerebellum has enormous neuroplastic capacity. When you give it consistent, appropriate challenge, it responds fast. Exercise 1. Pelvic rotation with limb coordination. Stand with your feet shoulder width apart. Begin rotating your hips in a slow, smooth circle. I'll show you. As you rotate, notice what your legs want to do. A rotating pelvis naturally initiates a stepping pattern. One leg will want to step forward and sweep outward in rhythm with the movement. Let it. Add that circular stepping motion in sync with the hip rotation. That's 2 movements running simultaneously. Now add your arms. Begin making alternating drumming motions with your hands, right and left, in their own rhythm, independent of the legs and hips. 3 simultaneous movement patterns, each in its own rhythm, none synchronized to the others. Let me show you the full combination. This is a serious cerebellar workout. The first few times you do it, the movements will collide. You'll lose the rhythm of one while trying to maintain the others. That is exactly what's supposed to happen. That awkwardness is the cerebellum working at the edge of its current capacity. That's the training zone. Each day you do this, it gets fractionally smoother. When it eventually feels effortless, and it will, that means new neural pathways have been built. You've upgraded the hardware. Exercise 2, spotting turns. You may have seen this in ballet or figure skating without knowing what it was called. Professional dancers can spin for dozens of rotations and walk off the stage without stumbling. They are not built differently from you. They were trained differently. Specifically, they were trained to use a technique called spotting. Here's how it works. During a turn, the head does not rotate continuously with the body. Instead, the gaze locks on a fixed point, a spot, and holds there as long as possible while the body rotates beneath it. Then the head snaps quickly forward to reacquire that same spot. This prevents the kind of continuous vestibular stimulation that causes dizziness. The vestibular apparatus, the balance organ inside your inner ear, is protected from overstimulation, and the brain maintains spatial orientation throughout the rotation. Pick a point on the wall directly in front of you. Fix your eyes on it. Now take 3 steps and make a turn, a full rotation. The moment you complete the rotation, find your spot again immediately. Build speed gradually, then reverse direction. After several turns, you may feel mild dizziness. Here's what's happening physiologically. Inside your inner ear, in structures called the semicircular canals, there is a fluid called endolymph. When you spin, that fluid accelerates. When you stop, it keeps moving by inertia, pressing on the hair cells that detect rotation. And your brain interprets that as continued spinning. With training, the hair cell receptors adapt. They become less sensitive to rapid changes in endolymph movement. Over time, you can make more and more rotations with 0 dizziness. This is a trainable adaptation. Exercise 3, Sufi spinning, advanced level. This is one of the oldest documented movement practices in human history. Sufi dervishes, a mystical Islamic tradition, used continuous spinning as a form of meditation and spiritual practice. They would spin for 10-15 minutes at a time at high speed, without stopping, without falling, without losing spatial awareness. From a neuroscience standpoint, this is the most demanding training stimulus you can give your vestibular system and your cerebellum. A person who has genuinely mastered Sufi spinning has built vestibular and cerebellar capacity so far beyond normal that walking across uneven ground in the dark is a trivial challenge for them. I'll show you what this looks like performed correctly. If you want me to do a dedicated video on Sufi spinning, the correct technique, the progression, the physiological mechanism, leave a comment below. I'll make it happen. Now, one more thing before I close, and it's clinically important. The age factor is real and it matters here. Cerebellar blood supply tends to decrease progressively as we get older because the vertebral arteries, like all vessels, gradually lose elasticity and accumulate stiffness in the surrounding tissues. In patients under 40, I often see coordination problems come from acute mechanical restriction, a bad posture habit, an injury, months of desk work. In patients over 60, I more often see it as a chronic, layered problem. Years of accumulated restriction compressing the vertebrobasilar circulation. The exercises work for both groups, but older patients need more patience and gentler progression. And they also need a physician to rule out other contributors before starting. So where do you fall in that range? How old are you? Leave your age in the comments. It genuinely changes what I'd tell you to prioritize in this protocol, and it helps me understand who's watching so I can tailor future content to what you actually need. Here is what you take away from today. If you stumble when you walk, the problem is blood supply to the cerebellum, routed through the vertebral arteries in your neck. The primary cause is mechanical restriction in the neck, specifically at the cervicothoracic junction and the upper cervical spine, that kinks those arteries and reduces flow. The solution has two components. Free the mechanical restriction and train the cerebellum directly. Your daily protocol. Mobilize the cervicothoracic junction every day, gently, 2 to 3 minutes. Add the cervical muscle stretch and finish with self-massage. Then train coordination, pelvic rotation with arms and legs, spotting turns, and Sufi spinning when you're ready. Do this daily. Progress is fast because the cerebellum responds quickly once its blood supply improves. I'm Sam Waterling. This channel is where I tell you. The healthcare system makes money when you stay sick. It does not profit from your recovery. Remember that. If this video helped you, subscribe and like it right now. We are close to 200,000. Let's get there.